Welcome everybody to another interesting session on cannabis and health and wellness, and this is a particularly interesting topic, and we're very excited to welcome Dr. Jeffrey Hergenrather from California, who's broken our drought when it comes to international guests at Mardi Gras. We've pretty much been running, yes, thank you so much. We've been running pretty much an Australian-only show since good old COVID. But yeah, things are starting to move again, and we're very grateful that Jeff and Star came over here to Mardi Gras. It's really exciting. So thank you very much. And thank you to Beck for bringing up this very interesting topic. So over to you.
Thank you. Thank you so much. I so appreciate, as soon as I found out that Dr. Hergenrather was going to be in Australia, I was like, I have to have this conversation with him. So Jeffrey Hergenrather is a general practitioner specialising in cannabinoid medicine since 1999. His medical experience includes 26 years in emergency medicine and private general practice. His involvement in the field of cannabinoid medicine dates back to 1977. He continues in a consultation practice in Northern California with face-to-face telephone and online consultations for the use of cannabis as medicine. Dr. Hergenrather's practice, research and teaching focus on the medicinal use of cannabis through a wide range of conditions and age groups from infants to end-of-life care. He's an adjunct professor at Sonoma State University teaching a biology course in medical use of cannabis. Thank you so much for being here. Welcome.
Thank you very much, Beck, and thanks to Kath and Michael and the Mardi Gras organizing body. It's really a privilege to be here, and I'm so appreciative. And it's an interesting topic that I'm glad to be able to share some knowledge about, because we don't get it from the literature, and I'll explain that as we go along. So we'll have some time for questions along the way, but we'll figure it out as we go. I'll get underway, and we'll get underway, and then go from there.
Yeah, cool. So I really feel that you are probably the most qualified to speak on this topic, given your OBGYN experience, your neonatal care and pediatrics practice. I have to say I'm a little bit nervous to be up here today because I'm clearly outing myself. I am 6 months pregnant, and I have had a particularly difficult pregnancy. I was incredibly unwell for the first 4 months. I was constant nausea, vomiting, retching, reflux, indigestion. I was very miserable for the first 4 months. And during that time, I also felt really guilty. I had thoughts of, like, I just want this to end. I want it to be over. I don't know how much more I can handle this. And at the same time, also feeling guilty because, I mean, I was surviving quite literally off bread, chicken schnitzels and fruit. And I just thought to myself, like, I'm not giving my baby the nutritional needs that it needs right now. And so there was a lot of guilt that I was experiencing then too. Although, you know, I've lived in America and I've worked in the cannabis industry there. And when I was there, the number of women who I spoke to were very open about their cannabis use during pregnancy and in motherhood. Whereas here in Australia, there tends to be some stigma and some judgment. And whilst I live in the Byron area where, you know, it's probably the home birthing capital of Australia, and people love to birth really naturally there. My obstetrician and my midwife are very supportive, but when I would speak to friends and well-meaning family members, they just they wanted to shut the conversation down, or, like, I really felt their judgment a lot. And so, yeah, I really just, you know, wanted you to really give us the nitty-gritty into, you know, is cannabis, or is responsible use of cannabis safe to use in pregnancy?
In a word, yes, and I'll fill in a lot more as I go along. Next slide, please. This has already been said. I will mention that I was a founding member of the Society of Cannabis Clinicians in California initially, and now it's been a worldwide organization, including an Australian chapter, which has kind of taken on its own identity now and is no longer directly associated with this Society of Cannabis Clinicians. But it's a group of doctors educating each other and educating the public about cannabis information. So there is a bracket there with cannabisclinicians.org, and there's some references. There's a library there, for example, that's free to the public, and I'll mention something more about it in a few minutes. Next slide, please. So this is just a brief bio. I don't want to dwell much on this. I am an MD, I am a general practitioner, and I have specialized in cannabis really over most of my career. Shortly out of medical school, my wife and I started having our own babies at home deliveries. I got known for that and began to expand my role as a doc, backing up midwives and doing home births. Beyond that, I did have a run with emergency medicine for about 26 years because it was a lot more convenient than was general practice to raising a family. And then in the last 25 plus years, I've been specializing in cannabis consultations, really in all age groups. In California, that was kind of peaking in the 20s, 30s, 40s, 50s. But after we went to adult use of cannabis, that population largely disappeared, and it's been the kids and the elderly people that I'm taking care of mostly with cannabis treatment plans. Next line, please. I'm going to give you a little bit of a picture background of my life briefly. Graduating from high school, I'm that white guy and privileged white kid that got to go to medical school, and then within about a year I started smoking cannabis on occasion, and you can see in the picture in the upper left-hand corner I had fully sprouted my hair and was a cannabis supporter, advocate through my medical school training, and really since then. At my you see my picture at graduation, hugging my wife with our firstborn child at our feet, and then you'll see our family photo in 1977 on the farm in Tennessee, and I'll speak quite a lot more about this as we go along because it's relevant to the question of is cannabis safe in pregnancy. Next slide, please. We moved after my second year outside of the medical training to the farm community in Tennessee. This is a hippie commune that formed in the early 70s. It was a vegan community intending to be agrarian. We had come from the cities all over the United States, and we did farm, although it was really difficult to make a living farming. And you can see how the gang circled up for meetings and our time together for information sharing. So this is kind of what it looked like, and actually in some ways still does look that way. We went from being a collective where we shared all things in common for the first dozen years, and then after that it finally kind of broke up and people began to have their own wallets and take care of their own needs. But for the first dozen years, that was not the case. We all lived together collectively. Next slide, please. We had a lot of kids. And this is a picture of the farm school circa 1979. And this is just a bunch of healthy children that we had. I think that the thing to understand about our use of cannabis in this community, we used cannabis freely behind the gates of our community. And it was for adult use only. The kids didn't really have access to it until they were clever teenagers and began to swipe it from us. But besides that, it was for the adults. And the women and the men used it equally, and it was just commonly used in our society. We did not have alcohol, we did not have tobacco, we did not have other drugs in our community. That was one of the agreements in coming to live in the community. So it was, we were a unique population in terms of our experience with having children with the use of cannabis and without complicating that with other drugs and tobacco and alcohol. Next slide, please. So this is a lot of verbiage. I don't really want to read it, but I think the point that I want to make is in the first about dozen years of the life of the community, we started, again, delivering our own babies, and by the time that we got there, I think in 1977, after my medical residency, there were about 1,100 births that had occurred, and in those births, there were no complications of low birth weight, preterm deliveries, small for gestational age, low APGAR scores, NICU admissions for babies in distress, none of the other problems with placenta abruptio, spontaneous abortions, stillborns, and so forth. We just did not have any abnormalities of that kind. Although if you go to the literature and read about cannabis and pregnancy, you will see a lot of fear-driven information about that would make you frightened about the possibility that cannabis could complicate your pregnancy and your offspring. New line, please. So before I go on to Jamaica, let me just say this, that we used cannabis freely. We did not mix it with tobacco. Women that were pregnant would use it ad lib as they needed for nausea, vomiting, ill feeling, no appetite, as Beck mentioned too. Sometimes it was heartburn, sometimes it was just didn't feel well. And cannabis worked quite well for that. They also, the women also used it just because they would huddle up among themselves in this difficult rural life that we lived in, and it was a lot of work. And so every few hours they might go off and burn one together, and that was just commonplace within our community. So the pregnant ladies shared that with among themselves, and it just became, it was part of our culture. So the next slide that I do want to talk about is Jamaica, and this is one area in the world where we also have a population of women that did not have the complication of these other drugs and alcohol. That is not true in the literature, and I'll get to that as we go along. But one of my friends and colleagues in this field is Melanie Dreher. In 1969, while at Columbia University in New York as an anthropology student, she was sent off to Jamaica to study pregnant women in Jamaica. So she moved into their homes in the highlands of Jamaica and studied the way they used cannabis in that community. Now, we all know from kind of the culture that we're aware of that the men in their working environment would roll these big spliffs and burn them and get incredibly high, and that was commonplace in their society. For the women, that was kind of culturally not acceptable. They did what they did, but they did it on more of a private basis. And so the women in Jamaica that she was in contact with, after a while, Dr. Dreher organized 30 pregnant women and had matched controls of women that were using cannabis with 30 women that were not using cannabis in their pregnancies. And the thing that was especially noteworthy in this community was that they too did not have alcohol, they did not have tobacco, and they weren't using other drugs. So it was kind of similar to our farm experience in that here too we did not have these confounders of these other drugs and alcohol that would muddy the data as far as what could happen to the pregnancies and the offspring that we were having. So these women would use cannabis in their daily lives Typically it was tea, but they may puff on cannabis as well in Jamaica. They would use it for their infants. So when they would have their babies, if the baby had colic, they may give the baby a little cannabis tea. And if they had children that were anxious or apprehensive about going off to school, they may treat the children with a little bit of cannabis tea before they would go off to school. So cannabis was just an herb. It was part of their lives, and it was nothing forbidden or weird for them. It was just part of life. And so we've come to recognize that the babies that they had in this study by Dr. Dreher were not at all depressed or harmed by the cannabis in any way. She wrote her paper and showed that these babies, not only at the time of birth, but over the first month of life, were thriving, and they were alert and attentive, even more so than the babies from the moms who had no use of cannabis in their pregnancies. And she wrote about it. She wrote about it in, after those experiences in the early 70s. It was not until 1994 that she got Pediatrics magazine to publish the findings. It's a long wait to be able to publish the data, but this is typical in cannabis literature, is that if you're not showing harm, you're not going to get funded and you may not get published at all. So that remains the case today. And so when Dr. Dreher went back to Jamaica a few years later to look at these kids when they were 5 years old and compare those 30 offspring to the offspring from the non-cannabis using moms, they were excelling and doing well. The cannabis exposed children, and she went to the authors of the Pediatrics magazine again, and they said, nope, not going to publish it. If you're going to show harm, we'll be interested in the paper. But as long as you're not showing harm, no way are we going to publish this in the United States. That remains the case not only in the United States, but pretty much worldwide. So if you're interested in it, I had Dr. Melanie Dreher come to my classroom when I taught a class on medical cannabis in 2018, and she has an interview that you can find in this particular link, and it's fascinating to listen to her storytelling about going to Jamaica and studying these women and all that it amounted to. It was really quite fascinating to listen to. So take a picture of that slide if you'd like to, and take a look at the link and see what Dr. Dreher has to say. Next slide, please. Now we're getting into the rest of the world, and this is to say, I'm sorry, this is still Dr. Dreher's paper, and I've kind of named it, and I won't read the text here, but the point is simply that in this neonatal period, these kids were thriving and doing very well, even demonstrably better than the kids from moms that were not using cannabis, which she was kind of fascinated with and reported on this in her paper. Next slide, please. So the short answer is we're not seeing these harms that are alleged in the literature in the women using cannabis in their pregnancy. So there is no evidence of harm to the mother or the baby when using cannabis in pregnancy, period. There just isn't. And there is lots of irrefutable evidence that women who are using alcohol and tobacco and other drugs are experiencing complications in those pregnancies. We know this, and we've seen it for decades. So it's, again, the short answer is no harm from the use of cannabis. I am going to launch into some papers that I want to get to, but I don't want to take you out of this. Okay. Next slide, please. So there are a lot of harms alleged, and I think you can just count on that, of this fear-based information about cannabis. This is just what we're dealing with in the world. And there are a lot of pressure on it, pressure to keep it so. Mostly in that you can't get funding, certainly in the United States, for anything looking as a medicinal value of cannabis. You can only get funding for looking for harm. So you'll see in the headlines, if you go to the headlines, that there is alleged low birth weights, allegedly small gestational age babies, allegedly increases in autism in the offspring of moms using cannabis. There's also some papers that are talking about spontaneous preterm births as a risk of using cannabis, ADD, ADHD as a complication of using cannabis, and other intellectual disabilities, and anemia resulting from the use of cannabis, and increase in NICU admissions, suggesting that these kids are in distress when they're born. I'll show you in the slides to come that these assertions of harm are unfounded. It's just what you'll get a paper published for. Next slide, please. There's two papers listed here, the top of which is the assertion of low birth weight and preterm births in cocaine use. And what the study looked at was 7,470 women, 16% of whom used cannabis. And the results of that were simply put to say that tobacco is the most commonly abused drug during pregnancy. Marijuana was relatively commonly used among these women in this series. Cocaine was rarely used, but they didn't see adverse birth outcomes in either the cocaine use group or the marijuana use group, but in the tobacco use group, they did see problems. And their conclusion was that 15% of all cases of low birth weight in the study could have been prevented if women did not smoke tobacco during pregnancy. This might be a good time to just mention the link between tobacco and cannabis.
Yeah. I mean, in America, it's blasphemous to mix cannabis with tobacco. But here in Australia, it seems to be quite a common thing that people tend to do. I mean, I've heard for many reasons, like, we mentioned this morning that for one reason is to hide the smell, but I've also heard from many people that they're convinced that it extends their cannabis, which I certainly don't think is the case. I think you become addicted to tobacco. So, and I think that then you're smoking more. So yes, I guess the thing about responsible use of cannabis in pregnancy is to avoid mixing tobacco in with your cannabis and just smoke cannabis, but maybe less of it. Yeah.
Perhaps that's valuable, and I think you use what you need. When women get so sick during the first trimester especially, I think it's just their bodies in a natural sense pushing off from loading up with too much of anything, too much food, too much whatever might be in food. So women typically don't eat so much during the first trimester. And I think to use cannabis, as Beck is saying, the responsible use of cannabis is cannabis only and not cannabis mixed with tobacco. That would be irresponsible in my thinking. So that's one thing to bear in mind. In this next paper, Neonatal Outcomes, this is a meta-analysis, and a lot of the studies done on cannabis are done in this meta-analysis format, which is to say the authors are gathering a whole bunch of papers that have similar storyline, that is, in this case, the use of cannabis in pregnancy, and then kind of sorting it out, throwing out the ones that don't have good data collection or just for whatever reason don't match the quality of the study that they're reporting on. So in this particular case, there were, I believe, 132,000 women, 6% who were describing their use of cannabis, a fairly sizable portion. Marijuana is the most common recreational drug in pregnancy. It's reported the prevalence of cannabis use in pregnancy is in the 31 studies ranged from 2% to 27%. I put that in red for my emphasis. I think somewhere in that 5 to 15% or 20%, just depending on where in the world you're studying people, is fairly typical. Women are using cannabis for medicine, as they should, because it is safe and it's very effective. A puff of cannabis and you've got a blood level within minutes. It quells the nausea, eases the heartburn, the many symptoms associated with the pregnancy, and then it doesn't last all day. It's just going to be episodic use as needed. I think that the point was that cannabis use in this group of women, it was seen as not being an independent risk factor for the adverse neonatal outcomes of low birth weight, preterm delivery, small for gestational age, nursery admissions, low APGAR scores, again, placenta abruption, spontaneous abortion, stillborns, neonatal deaths, after having adjusted for confounding factors, which is a busy way of saying they didn't see in this group of women any complications associated with use of cannabis in their pregnancy. Next slide, please. This is a paper that came out in 2016, and it's a consortium called the SCOPE Consortium in Australia, New Zealand, Ireland, and the UK. And in this case, they were looking at 5,588 women, all nulliparous first pregnancies. They had reported 5.6% reported cannabis use. So that's probably fairly accurate. There were, in this group, there were 11 who had a preterm delivery, 11 out of 5,588. And in order to get a paper published, their conclusions were these: use of marijuana among young women of reproductive age is a major public health concern, and we recommend that it is prudent to abstain from marijuana use during pregnancy. That's the way you're going to get it published. Otherwise, they're not so interested in it. So again, assertions of harm, a little bit of fear, but as far as the evidence, it just isn't there that you are actually seeing any significant number of these complications of pregnancy and cannabis use. Next slide, please. This is in that same slide, and it's not visible to you, I'm sure, but the graphic on the left shows 40 weeks gestation, and then each bar is another week. And what they're suggesting on the bottom axis is the number of joints that are smoked during the pregnancy. And so they're starting out with 0, and then I think it's 50, 100, 150, and 200 joints were being smoked. These are predictions as to what would occur that Lemanx described in this scope evaluation. And it just is really senseless, quite honestly. Women who use marijuana also tend to smoke cigarettes and are more likely to use other drugs and alcohol. This is what they admit are confounding variables. They tend to smoke tobacco, they use alcohol, and there are percentages here at the bottom. The Australian women aged greater than 14 years of age who used marijuana in 2010 were 82.7% also consumed alcohol during their pregnancy, and 68.5% of them, of these women, were also cigarette smokers. Again, the red print is my emphasis, but you get my point. They're making these predictions based on the fact that these women are using a lot of alcohol and tobacco in their pregnancies. And to blame cannabis for it is just wrong. And that's what happens in the literature. Next slide, please. This one is a bit upsetting, and I had to read it carefully before I kind of understood what was going on. Neurodevelopment outcomes in maternal use of cannabis. This is talking about, are these kids ending up being autistic kids? We do have an epidemic in the world of autism. We do have an epidemic in the world in dementia. This is happening worldwide. Well, at least in terms of this cannabis and pregnancy world, the assertion was, well, maybe it's the cannabis that's causing the autism. So the study was done in Canada, in Ontario, Canada, and what they did was they looked at 500,000 births in Ontario, Canada, a huge number. And of that number, 0.6% were admitting that they used cannabis in their pregnancy. This is in Ontario during those years when cannabis was illegal. And I'm sure the women just didn't want to have the heat or the exposure of saying, yes, I'm using cannabis, and have it tracked down and cause them trouble for that fact. 0.6% using cannabis is not a likely number. It's very likely that this is really more like 10% of women are using cannabis. They just didn't want to be known for that use. So in this very small segment that admitted use, and also would have had confounders again with the use of alcohol and tobacco, they did see an uptick in the number of autistic kids. It wasn't a great deal of increase. They said 4 per 100,000 person years among children exposed to cannabis compared to about 2.5 per 100,000 in the unexposed children. The data just isn't strong and is kind of easy to dismiss when you kind of look at it in a more practical way. Next slide, please. So this is about prenatal exposure to cannabis and maternal and child health outcomes. Again, a meta-analysis, and this one is done by Gunn in 2016, and he made a lot of assertions about the harms associated with cannabis use, the first of which was about lower birth weights. And what we found in his data, when you pick apart the data, please go to the next slide. I guess can you back up a slide? Thank you. There may have been 100-gram difference in the weight of the offspring in these moms. And, you know, we're talking about a 1/4 pound difference in weight in moms that were admitting to using cannabis. But also there's the confounder of tobacco and alcohol use. Again, they were unable to separate the cannabis users from those that were using other drugs and alcohol. So next slide is about anemia. He asserts that women smoking pot are going to be getting anemic during their pregnancy. Well, if you go to actually tease the data apart, you're seeing that there were 24 papers reviewed, 6 of which addressed the red blood cell count of the women. And of those, only 1 study found anemia. Well, the evidence is kind of weak already. But the other element to that is that they didn't do any pre-pregnancy screening. So these women may have come into the clinics already anemic, and that would have been included in the data set. So it just, again, did not hold weight that these women are getting anemic using cannabis in their pregnancy. Next slide, please. Okay, this is again about low birth weight, so I did have it in another slide. Owing to the number of studies that account for concurrent cannabis, alcohol, and tobacco use, there's just a low number of those studies, and the studies reporting outcomes of in utero exposure to cannabis in the presence of smoking tobacco and consuming alcohol were included in the study. So again, it's dirty data, and the author is getting published because he's blaming cannabis and not really relying on the point that is more likely that it's the tobacco and the alcohol that are causing the risk. Next slide, please. NICU admissions. There is an increase in NICU admissions, but in the United States, there are laws about testing women who come into the hospital to have their baby. They get tested for pee testing or for blood testing to see if they're positive for cannabis. And if they are, they're mandated, the hospital is mandated by law to put the babies into the ICUs after their deliveries. So it's kind of a cruel practice and not necessary. These kids did not have low APGAR scores. They were no way under duress, but it does show in the data that these babies, these cannabis-exposed babies, did end up in NICUs. It's just that it didn't have anything to do with the health of the baby. And the next slide, please. So again, my conclusion is unaltered. There is nothing definitive in the literature to conclude that there is any harm to the mother or the baby when using cannabis in pregnancy. And there, again, is ample evidence that tobacco, alcohol, and other drugs can be responsible and is responsible for these abnormalities seen in pregnancies. So.
Thank you. That's definitely making me feel very grateful that I'm staying out of the medical system. And my baby is not going to be taken off me.
We're all for home birth.
Yeah. One thing I have noticed is that none of the studies ask the women why they are using cannabis. Now, obviously, we understand why, but do you think that that's part of why there is still a lot of stigma, and do you think that there needs to be more research done into questioning why women, because I guess they're making out that cannabis is a drug and that these women just don't want to give up their drug use as opposed to that they're using it as a medicine. So do we need to be questioning that more and possibly doing some more research and asking the women why they're using it?
I think it's a good idea to make an interesting study to actually have them tick the box and show what they're using it for. I think for the regulators, for those that are seeing harm in cannabis use, they are going to make those assertions that, oh, you're hooked on cannabis or some nonsense like that, and consequently you can't help yourself and you're just going to smoke anyway. I think it is important to recognize that those symptoms that you were describing are classic, and that it would be valuable to know what's typical of women, not only who are using cannabis and what benefit they are getting, but compare them to the non-cannabis users who are also experiencing those same issues, and how they're dealing with it in that population of women not using cannabis. They may go to other drugs, the Zofran or whatever, not uncommonly prescribed for women who are dealing with nausea and vomiting of pregnancy. Yeah.
When I, so my prior to being pregnant, my preferred method was to use a bong, to smoke my medicine, to use it. And as soon as I found out, which was very, very early on in the pregnancy, I was tracking it. This was a conscious conception. And so as soon as I found out I was pregnant, I gave up smoking bongs immediately. And I will admit that there were tears when I told my partner that I was giving it up. And I went to, because I thought, oh, well, I'll just stop smoking altogether. I tried vaping, I tried edibles, and also oils and tinctures. And for me, none of it touched the sides. It just didn't help. So I gave up. I was just like, ugh. This is the first time, in the last 15 years that I've been using cannabis that cannabis is not working for me. And I was like disappointed in it. I was like, what the hell is going on? This is not my medicine. This is like the relationship I have has always been really supportive. And about 10 weeks in, I was just like fed up. I was so unwell. I was crying. And so I finally just rolled a joint. And as soon, like literally the first puff, I was like, oh, there's that relief. So is it just person dependent as to what method they use, as to what helps them?
That's a good question. And I think there is a significant difference between inhaled cannabis and ingested cannabis. And I applaud the mob for putting that little segment in the paper. If you've got that calendar of events, there's a section in the right upper corner defining the difference between inhaled and orally ingested cannabis. we're dealing with really quite a different metabolism and drug exposure when we're inhaling cannabis. And what you're describing, Beck, is to inhale cannabis from, well, I would say from either vapor or, and I would say whole plant vapor, and or smoking, and getting those compounds into your bloodstream. That's where you're going to get the THC. It's going to last for about an hour of a potent effect, and it falls precipitously, really in a exponential fall. So by the end of the first hour, there's very little of it left in your bloodstream. So that is distinctly different from taking it orally as a tincture or some edible. Not that it's the wrong way to use it, it's just that it has to go through your liver first. Once it gets to the stomach, it's on through the portal vein to the liver. There it is largely metabolized by the liver, and what shows up in the bloodstream is predominantly 11-hydroxy-THC, a rather psychoactive compound. Presumably it has similar effects as far as nausea and vomiting and the other symptoms that Beck has described about in her pregnancy. But we know that inhaled cannabis is very fast and effective and doesn't last as long, whereas the orally ingested is going to last at least 4 hours, and depending on whether you take it with or without, or with, I should say, a fatty meal, that pushes the curve further to the right, and you have these 11-hydroxy compounds lasting in your bloodstream for 6, 8 hours, 10 hours, even longer if it's taken orally with a big fatty meal. Now, pregnant ladies aren't necessarily eating big fatty meals, but that's the way the metabolism runs. And I think that we know from historical sense that a puff of cannabis is really all you need, and it just makes sense. You know, I could also say we don't really know the difference between a puff now and then and smoking continuously during pregnancy. There may be consequences of that we just haven't seen because we haven't really been able to have a population of women who are cannabis-only users and compare people that are just using a toke 3 times a day versus somebody that is smoking heavily all day long. There could be differences. We don't really know. But I think it's a reasonable question to ask. I think that taking it inhaled is probably much more sensible to me because it's in and out of your bloodstream quickly and it does what it's there to do.
Yeah, there was definitely a time when I ate an edible and I couldn't control the dose, and so I didn't actually know how much I was having, and it just wasn't comfortable. It wasn't a comfortable experience for me. I just had to go and lay down and go to sleep because it felt too much, and my tolerance immediately crashed. You know, I really didn't need as much as what I used to need or require. So yeah, I really, as my partner literally said to me straight away, he's like, no more edibles, enough of trying the edibles. We've done that, let's go on to something else. But yeah, that also went into the next question of, is there a level of cannabis use that you would not be recommending? And would it, or does it just depend on a person's tolerance?
Well, I'm pretty comfortable with cannabis use in pregnancy and cannabis use in any medical issue. This has been my specialty for decades now, and some conditions really require a much heavier dose of cannabis. In the talk tomorrow, I'm going to speak about our endocannabinoid deficiencies and probably speaking to the fact that we know that there is a difference in these CB1 cannabinoid receptors from person to person, and we've been able to see these polymorphisms is what they're spoken of in the literature. And there are a few pages of different conditions where people's CB1 receptors just don't work the same. We know that from altering one amino acid in this chain of amino acids that makes the CB1 receptors in the brain, that would be responsible for using cannabis to activate in order to quell the nausea. We know that if these receptors aren't working as well in various medical conditions, that you simply can correct that with more regular use of cannabis. You're kind of taking advantage of the fact that you can use this exogenous form of cannabinoids where your own natural system, your endocannabinoids, may not be doing the job that they could be doing. So some women are going to fly through their pregnancy and have very little nausea and vomiting. Maybe it's because their natural endocannabinoid system is pretty good at making an adequate amount of cannabinoids to quell their nausea and vomiting. Whereas others may just not have as good a system, and they are much more prone to the nausea and vomiting of pregnancy. And again, outside of pregnancy, in medical conditions, ADHD is a classic one in my opinion, and PTSD. There's a number of these conditions that have been designated as having polymorphisms of the cannabinoid receptors. Again, the cannabinoid receptors don't work as well. If you activate them with cannabis, with the THC, specifically THC, it cools them out, and you can put to rest these many of the medical problems. So that's another topic for tomorrow, but I wanted to mention it.
So, like I mentioned at the beginning, a lot of the women who I met in the States who were very open about talking about their use, they spoke about it in pregnancy, but also in motherhood. But I've also, when I came back here, which I consider, when I moved back from America back to Australia, I was like, oh my gosh, I'm going back to the dark ages. We're so far behind. But I've heard women say, oh, well, you're not going to use cannabis once the baby's born. You'll fall asleep and you won't know that your baby needs you. What would you say to that?
Ha 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 ha. It just isn't so. I mean, you can, eventually, overdoses of cannabis will knock you out. It's true. You know, you get hundreds of milligrams of THC on board, and it'll, you know, still, a baby crying on a baby's knees is going to wake up anybody. But I think that it just is not of concern to me that you would be able to use cannabis safely as a mom, and even exposing your baby to these trifle amounts that could get through breast milk into the baby.
Well, my understanding is that there's cannabinoids in breast milk, so would it benefit your breast milk? Would it, and therefore benefit the baby?
Well, I'm going to look to Dr. Dreher's work in Jamaica and say, yes, there are colicky babies. Some babies are just different. And if you have an infant that is, you know, gets to be 5 o'clock in the afternoon and they start fussing and they're going to fuss for a couple hours, a few drops of cannabis tea may quell that and make the baby comfortable in a short amount of time. I see that as a nice herbal medicine to take advantage of, and I don't see any harm, or, you know, it makes no sense for me to feel that there's a fearful situation that you're dealing with in using a little bit of cannabis. So I'm not worrying about a little bit of cannabis THC to augment our natural cannabinoid system in order to achieve a healthy state.
When you were on the farm, were women using cannabis during the actual birth and labor? I literally just outside a woman just told me that she actually did use it during labor and birth. Birthing, and I mean, I haven't read or heard anything really about that. So can you share anything?
I'm glad you asked that, and I think it's in the farm community. We used cannabis frequently during labor and delivery. It gave women comfort. It gave them a sense of humor. It gave them some bonding with their partner. It just offered a pleasurable break to the the difficulties of labor and delivery. And it didn't have any adverse effect on the progression. And in fact, many times we saw the progression of labor and on to delivery enhanced with the use of cannabis. So there's a relaxation of smooth muscles in the body from cannabis, from THC. And so if the cervix is relaxing a little bit and helping to dilate, or if fear is being reduced, then often the progression of labor is really enhanced with the use of cannabis in labor and delivery. So I'm a big fan of it and seen so many times in backing up the midwives that cannabis worked very well in labor and delivery.
Fabulous. Thank you so much. I'm all out of questions, but I'd really love to throw it out to the audience to see if there's any questions we've got out there. Oh, yes.
I wait for the mic to come, and it's coming your way.
Thanks. Just curious, a question around men and their use of cannabis and how that may or may not affect male fertility and any impacts on the pregnancy and health of the baby. Do you have any experience in that or know of any research that's looked at that?
I'm not sure what the question is yet. Hang on to the mic a little longer. So the parent or the husband or the male partner using cannabis?
So prior to conception, I would say, men that are using cannabis. Is there any research that looks at positive impacts or any harm to male fertility and any carry-on effects to the health of the baby in pregnancy?
Typical in modern urology to tell couples if they're having difficulty conceiving that the male is best to to stop use of cannabis because of a fall in sperm count. That does happen with regular use of cannabis. The degree of the fall, I don't know exactly, it might be 10 or 20% of the sperm count is reduced. But as far as conception, we never saw a problem with conception. It just wasn't significant. So I don't see any other harms from the male partner using cannabis during that conception part of the
awesome
having children.
Yeah, thanks for that.
Yeah.
Any other questions out there?
I got the mic for a moment.
Yeah.
Dr. Andrew Catalaris, I've been prescribing all of it illegally for about the same time as you. With regard to pregnancy especially, could you speak about dietary supplementation? My experience is if pregnant women, before they're pregnant, are amply supplemented on alpha-linolenic acid, especially from hemp seed and chia seed, things like that, you don't tend to get, certainly postpartum depression is the most clear one you can prevent. And I've done that in a couple of patients that had bad postpartum, supplement them for the next one, not a problem at all. People seem to forget the role between diet and the endocannabinoid system, because if you don't have the right cell membranes to make the anandamide, you don't have a functioning endocannabinoid system. So I consider the dietary repletion of alpha-linolenic acid and other essential nutrients to be critical to cannabis therapy, in addition to the immediate stimulation of the endocannabinoid system. Anyway, that's half a statement, half a question. But yeah, all women, everyone to be consuming more hemp seed, basically. You'll do your child a favour.
Well, I don't know if I have much to add to that. I think good nutrition makes sense, and I think nutrition in pregnancy is kind of regulated by the body, and you don't eat the same way when you're pregnant.
Absolutely. I mean, for the year prior to being pregnant, I ate a fairly strict animal-based diet, and I'm actually really glad that I did, because I think that really actually got me through my baby through nutritionally during that time. And it was interesting because one of the things that I noticed immediately was that I could not eat beef or eggs like straight away. It made me so unwell. I couldn't even say the word eggs without retching. It was that intense. But now I can, and so I'm back to my diet. but I've actually noticed that the minute, like, I can't deviate from that diet anymore. Like, I hear women telling me that they're like, oh, I survived in my pregnancy on chocolate and ice cream. I'm like, that is not my experience whatsoever. If I deviate at all, I am incredibly unwell, but I'm so grateful that I can actually eat meat and eggs. So actually my diet's quite high in fat. You mentioned earlier, like, I was like, oh, I think maybe I'm the exception there because my diet is quite high in fat. But yeah, I definitely feel so much more like healthier, and that I can actually get through the day without having to nap. Whereas the first 4 months, I was sleeping like 2 or 3 hours during the day as well as over night time. So yeah, I definitely think that nutrition is very important before and after.
Yes, I agree. What else about nutrition? Well, one comment about the endocannabinoid system is we produce endocannabinoids on demand. That's when we make them, is when we need them. And they're produced on demand, and they're usually metabolized rather quickly on site. Some of them enter the bloodstream, and we can see them circulating. We know that autistic kids, for example, have low circulating endocannabinoids. For what the meaning of that is, I can't say. But I think in general, good nutrition is very important. I can't attest to any particular supplements that would be valuable, but I certainly know that some foods are really difficult for women to tolerate during early pregnancy, and there may be a reason that will come to discover yet in the future.
Great. I was going to say, sorry, just one more question, and then we're going to round up. So,
yep. Cool, thank you. You kind of answered my question already, which was in regards of how to assess the level of endocannabinoids that somebody is able to produce and has floating around in their bloodstream. So, because it would be very useful, for instance, to have that sort of data if someone becomes pregnant and then exhibits, nausea, then you'd straight away know what the treatment would be for that. So, anyway, you can test. How do you test?
Well, that's a good point, and we make them on demand. And if we're nauseous and can't eat, and we're in need of nourishment, our body is supposed to step up and make the natural cannabinoids and quell the nausea and stimulate the appetite. And generally that works pretty well. But early pregnancy, for the first 10 to even 20 weeks, can be really challenging. And I think there must be good reason for that we don't understand yet. The body is smarter than we are. Thank you for the question.
yeah,
Awesome.
thank you so
Thank
much.
you. Thanks so much, Dr. Jeffrey. I really appreciate your time here today. And thank you, everybody. And thanks for coming.
And as we always say, I'm sorry to people that had questions. Feel free to chat to Beck and Dr. Hergenrather. They will be here this weekend, and yes, there'll be other opportunities to ask questions of Jeff tomorrow as well. He'll be speaking here in the hall again. So thank you again. And please stay in the hall. We've got one final session before the Combi Convoy. Kate Fairman from the Greens and Jeremy Buckingham will do basically a roundup of how you deal with Labor in New South Wales and how you get some effective change with cannabis law reform.
Labor in pregnancy or Labor there?
Labor in pregnancy.